Mr. President, I think virtually everybody in our country understands that the United States of America is in the midst of a major health care crisis. We have 46 million Americans without any health insurance. We have even more who are underinsured. And we have, in addition to all of that, we have some 60 million Americans, 20% of our population, who do not have access to a doctor on a regular basis. The result of that particular fact is that we lose over 18,000 Americans every year who die needlessly, who should not die, because they don't go to the doctor when they should get the treatment that they need. That is 6 times every single year what we lost on 9/11, of people who die who should not die because they don't have access to a doctor. Mr. President, in the midst of this horrendous lack of coverage, unique, I should mention, among major nations on earth, the United States spends far more per capita on health care than any other nation, and those costs continue to soar. So when people make international comparisons of the United States with other nations and how well or not well we're doing, that's good to do, but we should always remember that we are spending almost twice as much per capita on health care as any other country. And there is certainly something wrong and dysfunctional about a system which spends so much and yet leaves so many people uninsured or underinsured or without access to a doctor or a dentist or other preventative health care. At $2.4 trillion and 18% of our gross domestic product, the skyrocketing cost of health care in this country is unsustainable, both from a personal point of view, the needs of individual Americans, and also from a macroeconomic perspective, what is happening to our entire economy. At the individual level, the average American today spends about $7,900 per year on health care. Can you believe that? Close to $8,000 per person on health care. And we all know folks who are out there making $20,000, $25,000, $30,000 a year, and we are spending on average almost $8,000 per person. Despite that huge outlay, unprecedented in the world, a recent study found that medical problems contributed to 62% of all bankruptcies in 2007. Medical problems, bankruptcies, and I should add that most of the people who went bankrupt had health insurance. They had health insurance, but what they had was inadequate health insurance. From a business perspective, as opposed from the needs of an individual, General Motors spends more money on health care per automobile than they do on steel. More money on health care than on steel, which might lead us to understand why they are where they are today. And small business owners in the state of Vermont and around this country are forced to divert hard-earned profits into health coverage for their employees rather than new business investments. You're seeing many small businesses are trying to do the right thing in terms of their employees, spending more than they have, and they don't have the money available to make the investments they need to make their businesses grow. And the result of that, of course, is that as a result of soaring health care costs going up 10, 15, 20% a year, many small businesses and medium-sized businesses are cutting back drastically on their level of health care coverage, or in some cases they're doing away with it entirely. More and more businesses in America are simply saying, I can't afford to provide health insurance to my workers. Now, despite all of that, we spend almost twice as much per person on health care as any other country. Despite that fact of our spending, you know what? People will say, well, you spend all that money, the results must be great. Well, that's not really the case. Bottom line is we get poor value for what we spend. According to the World Health Organization, the United States ranks 37th in terms of health system performance, and we are far behind many other countries in terms of such important indices as infant mortality, life expectancy, and preventable deaths. So, We are spending almost double what any other country on earth is spending. We got 46 million without any health insurance. We have more who are underinsured. We have thousands who die because they can't get to a doctor. And then in many other health care outcomes, we are behind many other countries around the world, some of whom are spending far, far less per person than we are spending. Now, it seems to me that as the health care debate here in Congress heats up, we as a nation have got to ask two fundamental questions. Different people will have different answers to it, but here are the two questions I think we've got to ask. First, as a nation, should all Americans be entitled to health care as a right? That's the first question. And honest people will have differences of opinion on it. Some people will say, well, you know what? Hey, some people have big cars, some people have small cars, some people have big houses, some people have small houses, some people have good health insurance, some people have no health insurance. That is the way life goes. Some people hold that view. I don't. I think that in America we should understand that every single person should be entitled to quality, comprehensive, affordable health care. And in fact, I think most Americans feel the same way. Second of all, if we are to provide quality health care to every man, woman, and child in this country, how do we do it in a way that doesn't bankrupt the nation? How do we do it in a cost-effective way? Those are the two questions that we have to ask ourselves. And Mr. President, I think the answer to the first question is pretty clear. And in fact, it's one of the reasons that Barack Obama was elected President of the United States. Most Americans do believe that all of us should have health care and that nobody should be left out of the system. We have a hard time understanding that Joe Smith, who works for one company, has good health care, and his neighbor, Mary Evans, who works at another company, doesn't have any health insurance at all. What sense is that? So I think as a nation, we are coming to understand that all of our people are entitled to health care as a right of being Americans, and the challenge that we face is how do we do it in a cost-effective way? In that regard, I think, and I speak obviously just for myself here, that the evidence is overwhelming, that we must end the private insurance company domination of health care in our country and move toward a publicly funded, single-payer, Medicare for all approach. And I think the evidence is overwhelming that if you want universal, comprehensive, quality health care for all people, that is the only way, actually, that you can do it. Our current private health insurance system is the most costly, wasteful, complicated, and bureaucratic in the world. Just today, not yesterday, just today, spoke to an individual who has a law degree, a very smart guy. His wife has a PhD, and they went through the federal employment benefit package. Between a PhD and a lawyer, they spent hours trying to figure out what particular program could work best for them. And all over America, people are spending countless hours trying to figure out, is it this program, is it that program? I'm young, I may not get sick, but you know what? I have a history of cancer in my family. Should I get this comprehensive? Should I get this high deductible? If I'm a small business, I can only negotiate this. I'm General Motors, I can self-insure. What should I do? And the answer is there are 1,300 separate private insurance companies in America peddling thousands and thousands of different plans. And let us be very clear, in case anybody has not caught on yet, the function of a private health insurance company is not to provide health care. It is to make as much money as possible. That's what its reason for existence is about. And in fact, when a private health insurance company denies health care, they make more money. And in fact, the record is pretty clear that private health insurance companies have given bonuses to people, their own employees, who are successful in throwing people off of the insurance policy because those people are running up high health care costs. Thus, we have the phenomenon, the insane phenomenon of something called pre-existing condition. What a term that is, pre-existing condition, meaning that you can't get coverage for the illness that you need to be covered for most. Person that had cancer 3 years ago, worried about a recurrence of cancer. Sorry, we can't provide insurance to you. Then you have other circumstances where somebody gets really sick, runs up a high medical bill, and the insurance company says, oh, we don't want to continue your policy because we have to pay out so much money. We want to go to some young guy who can run the marathon and who promises us never to get sick. Those are the guys we want to cover. This is an insane system. It is a wasteful system. It is a bureaucratic system. How many people are spending half their lives on the telephone arguing with insurance companies to cover the claims that they thought they were covered for? So people on one end of the phone are spending huge amounts of time and money doing that, and at the other end of the phone, we're paying somebody to tell us that we don't have coverage for what we thought we did have coverage. With thousands of different health benefit programs designed to maximize profits, not provide health care, private health insurance companies spend an incredible 30% of each health care dollar on administration and billing, exorbitant CEO compensation packages, advertising, lobbying, and campaign contributions. One of the lovely things that the insurance companies do and the pharmaceutical companies do after they rip you off and they make huge profits, they take some of that money to hire all these fancy guys here in Washington, D.C. to protect the status quo. And the bottom line is, and all of the evidence makes this clear, that public programs like Medicare, Medicaid, the S-CHIP program, and Veterans Administration are administered for far less money than our private health insurance companies. Mr. President, in recent years, while we have experienced an acute shortage of primary health care doctors, nurses, and dentists, we are paying for a huge increase in health care bureaucrats and bill collectors. Here's the insanity, the dysfunctionality of the current system. We don't have enough primary health care doctors. We don't have enough dentists. We don't have enough nurses. We don't have enough medical personnel. Don't have enough of those people. But over the last 3 decades, we have seen an explosion in the number of health care bureaucrats and people who are bill collectors. Now, to my mind, I'd rather see somebody hired who can help somebody get well or prevent disease, not somebody on a telephone billing us or arguing about what we owe or don't owe. The fact of the matter is that over the last 3 decades, the number of administrative personnel has grown by 25 times the numbers of physicians. 25 times more bureaucrats than physicians. Well, we don't need health care bureaucrats pushing paper. We need primary health care doctors delivering babies, taking care of the elderly, and taking care of those people who are sick. Not surprisingly, while health care costs are soaring, so are the profits of private health insurance companies. From 2003 to 2007, the combined profits of the nation's major health insurance companies increased by 170%. Healthcare costs are soaring. Profits of the health insurance companies are also soaring. And while more and more Americans are losing their jobs and health insurance, the top executives in the industry are receiving lavish compensation packages. It is not just William McGuire, the former head of United Health, who several years ago, Mr. President, accumulated stock options worth an estimated $1.6 billion. Okay, $1.6 billion a few years ago for the CEO of United Health, and we don't have enough money to provide health care to people who are uninsured. And it's not just head of Cigna, Edward Hanway, who made more than $120 million in the last 5 years. The fact of the matter is that CEO compensation for the top 7 private health insurance companies now averages over $14 million apiece. Moving toward a national health insurance program which provides cost-effective, universal, comprehensive, and quality health care for all will not be easy. It is the major political struggle that we face right now. The powerful special interests, and they are all over Capitol Hill. They are all over. The lobbyists are here. I would say that in the midst of the recession, Mr. President, I would suggest that while unemployment in general is soaring, my strong guess is that unemployment for healthcare lobbyists and pharmaceutical industry lobbyists is going down. Those guys have plenty of jobs and they're making plenty of money. And I am quite confident that those lobbyists will wage an all-out fight to make sure that we maintain the current dysfunctional system which enables them, the insurance companies and the drug companies, to make millions and billions of dollars in profit. In recent years, they have spent hundreds of millions on lobbying, campaign contributions, and advertising, and with unlimited resources, we have no reason to believe that they will not continue to spend as much as they need. But at the end of the day, as difficult as it may be, the fight for a national health care program will prevail. Decade after decade after decade, all over this country, people fought for a civil rights movement which said we will judge human beings not on their color, but on their character, who they are as a human being. The struggle for women's rights went on decade after decade before women had the right to vote or had a seat at the table. And in my view, the struggle for health care is the civil rights struggle of today. And I believe that 30 years from now, 50 years ago, people will look back and say, I don't believe that there was a time in America where people who got sick couldn't find a doctor, where people went bankrupt because they committed the crime of being sick or having cancer. I don't believe that. And our job, Mr. President, is to bring that day when every American has health care as a right in a comprehensive, cost-effective manner. Our job is to make that day come sooner than later. And if we work together, and if we have the courage to stand up to the big money interests who want to maintain the status quo, we in fact can do that. Thank you, Mr. President, and I would yield the floor.